please.
Hello everybody, good afternoon. First, I hope all of you are doing well and safe in these difficult times across Europe. And although all our attention, at least the media attention, are very much concentrated on this COVID issue, I think that, and this is an important message, what we are here today discussing, the relation between diabetes and your heart, is causing much more deaths and much more impact on the quality of life of the people than the COVID situation. So this is, I think, an important message, and this is very clear from all the numbers across the globe, in Europe, in the US, that the number of deaths due to diabetes and heart disease is much bigger than the COVID situation. The second thing that I would like to stress, and Sarah today started with this message, that when you talk about diabetes, there are a series of misconceptions, of wrong conceptions regarding the impact of diabetes on the quality of life of people and the impact of diabetes in understanding this disease. And Sarah said in the beginning that some people thought that at the beginning diabetes was a mild disease. We now know very clearly from what we have seen that diabetes has serious consequences, not only on the heart, but also, as Professor Washer has already said, in the multiple systems and multiple organs. The second thing that Sarah said, and this is something that is wrong and that we know clearly, diabetes is not only a glucose problem. Diabetes, we can say that diabetes is also somehow a cardiovascular disease with a big impact, not only in mortality, but also in the quality of life. And so I think that one of the key messages also that we would like to stress is that all of us as doctors and as patients, but
Ricardo, just to let you know that for some reason you appear to have gone onto mute all of a sudden. Could you perhaps unmute yourself and repeat what you were saying in the last 1 minute or so?
Can you hear me now? Can you hear me?
We can indeed.
Yeah, sorry.
Can indeed.
Okay. So I was saying that, as you said, Sarah, you said that diabetes at the beginning, we thought at the beginning that it was a mild disease. Now we know very clearly that this is a serious disease with a big impact in several organs beyond the heart. Diabetes is not only a glucose problem, diabetes is a disease that affects several places of your heart and of your organs. And also, as I was saying some minutes ago, in this next World Diabetes Day, one of the key messages, I think, is to understand that each one of us, every doctor, every patient, but also every journalist, have an important role in explaining to the society, to our patients, the importance of this interconnection between diabetes and the heart. And actually, I usually say that these two diseases are the interconnection or the intersection of two pandemics, two real pandemics. On one side, you have seen the impact, the numbers of diabetes worldwide, which keep increasing every day and will continue to increase in the next years. And on the other side, the main cause of death that we have worldwide, which is cardiovascular disease. And so this is an important message to understand the association between diabetes and cardiovascular disease. And so I think that this is the key slide to sum up what we have discussed until now. The first message that you have seen is that when we talk about diabetes, we are talking about a disease which more than doubles the risk of having a heart attack or having a stroke. And you know that the impact that a heart attack or a stroke can have, not only because of the risk of death, but mainly because of the impact that it has on the quality of life. The second thing is, and Professor Washer sees this every day. When he deals with his diabetic patients, he knows that diabetic patients will die mostly of cardiovascular disease, and there are several strategies that we can implement to reduce the cardiovascular risk in patients with diabetes. But more importantly, I think these numbers tell you everything. The impact that diabetes has on cardiovascular disease makes that it can reduce the life expectancy of the person by 12 years. And this is very clear to understand why we need to discuss this today, why we need to keep these messages and transmit these messages to our patients, to our families, to our society. The last thing that I would like to stress, because we didn't talk about this today, when we discuss the relation between diabetes and your heart, some people focus too much on the relation with the risk of having a myocardial infarction, a heart attack, or a stroke. But something that is quite recent and that we are understanding is that diabetes is an important disease in the development of the most serious heart disease, which is heart failure. As you probably know, heart failure is a disease which is characterized by the inability of the heart to pump the blood. And so these patients have high shortness of breath. They have a very high impact in their quality of life. And what we are now understanding is that diabetes has a very close link, not only with stroke, not only with myocardial infarction, but also, and very importantly, with the risk of this very serious heart disease, which is heart failure. So this is, I would say, the diagnosis slide. So what can be the key messages to transmit to our patients, to the society? What can be the treatment to reduce the impact that diabetes can have in your heart, in your risk of myocardial infarction, in your risk of heart failure? And these are very simple measures that each one of you can implement to reduce the risk of heart disease and to protect your heart. The first one is quit smoking. I usually say to my patients that if they have diabetes and they keep smoking, is like having, being an ambulatory bomb. You are about to explode, because the two together lead to a very high risk of heart attack and of stroke. The second thing, you heard that patient also today speaking, to be physically active. Why is this important? Because it not only treats your diabetes, can help, for instance, to control blood pressure and glucose levels, but also by keeping physically active, activates your heart, and it is important for reducing this risk of heart disease. And then there are two other very simple and important questions. Remember that diabetes is not only a glucose problem. It is very important that patients check regularly their blood pressure levels, because the two diseases, hypertension and diabetes, have a major impact in the risk of a cardiovascular event. And the second thing, and this is very clear now, that patients with diabetes need to have very low levels of cholesterol. So controlling cholesterol in patients with diabetes is a simple message that reduces risks of cardiovascular disease and which saves lives. And the final message, and if you were listening to the video where we had the patient talking, there was one key message that this patient talked to us, and I think this is very important. The patient said, so don't forget to look for a diabetologist who looks after your heart. And this is a very important message. Why? Because you know that it is important for the patient not only to speak with the doctor about the risks of having heart disease. So people and the patient, and Sarah also focused the importance of this shared decision making. It is important for the patients and for us as journalists, as members of the society, to pass this message so that the patients can also talk with their diabetologists, with their cardiologists, with their general practitioners about the risk of heart disease when they have diabetes. So I will not go into much detail. I'm available for all the questions that you have, but this is very clearly just two slides to understand the most important messages when we convey this information about the importance of treating heart disease in patients with diabetes. To finalize, we have selected here some questions that a patient can ask to his doctor or his nurse during an appointment to remember him and to stress also for the patient the importance of this association. And from all of these questions, I would like to stress two of these messages. It is important that the first question, which is, as a person living with diabetes, if I should be concerned about my heart and what is my cardiovascular risk, because you know that doctors have simple tools to address and try to foresee the risk of a cardiovascular event in a patient with diabetes. And so this is a good question to address with your doctor and to discuss with your doctor what you can to try to predict if I am in very high risk of a cardiovascular event or if I am not in such a very high risk of cardiovascular event. And the second question that I would like to stress is so that the patients can also address and discuss with their doctors in this process of shared decision making to ask the doctor which treatment options can reduce the risk of a heart attack. And we have discussed this very clearly. And I would say that there are four main pillars. First, this kind of general measures like physical exercise, keeping a good diet. The second message is to treat very well your blood pressure because it will reduce the risk of heart disease in a patient with diabetes. The third pillar would be to control the cholesterol levels, which should be very low in patients with diabetes. And fourth, and very important, we nowadays have tools and have ways to treat diabetes, and beyond reducing glucose levels, we have new treatment strategies to not only reduce glucose, but also to protect your heart. So we have new options to reduce this cardiovascular risk in the patient with diabetes. And with that, I pass my presentation and I'm available for all your questions and your doubts that you can have. Sarah?
Ricardo, thank you so much. I think that was a wonderful introduction from both you and Thomas, and I'm really grateful to both of you. Now, we will be joined, of course, straight after the break by Jean-Luc Aissele, who is, as I mentioned before, the CEO of the World Health Federation. If there is anything you'd like to ask him as well, please feel free, but he will be available after his session to answer specific questions which might have arisen. But could I please urge you to ask your questions? We are here for you. So we do have a few questions which have come in, but if you have anything that you would like to say now, please do submit it, and we can either answer it now before the coffee break or afterwards if we don't have time for all of them. So the first question that came in was actually a question from my presentation. Over half of people with type 2 diabetes will lose their lives to cardiovascular disease. Is this a UK, European, or a global figure? And the answer is it doesn't really matter. Actually, it comes from a systematic review, which was a worldwide systematic review from 2007 to 2017. So it did show worldwide cases, but we have to bear in mind that unfortunately UK cases are very, very similar. Regardless of whether we're looking at heart attack, at stroke, and so on, then unfortunately we have similar cases in the UK compared to people without diabetes. People with type 2 diabetes, as we've already said, nearly 2.5 times more likely to have a heart attack, more than 2.5 times more likely to experience heart failure, and twice as likely to have a stroke. In fact, diabetes directly causes 1 in 5 strokes. And 1 in 4 people who end up in hospital because of a stroke, heart failure, or a heart attack have diabetes. So really, really compelling figures there. Okay, so if you have type 2 diabetes and you have been a patient for a long time, can you still reduce your cardiovascular risk? Ricardo, can I come to you to answer that one?
Yes, and the answer is very clear. And the answer is yes. By how? Although it is true that people with long-standing diabetes have a particularly increased risk of having heart disease, there is a relation between the duration of diabetes and the risk of heart disease. It is true that these 4 simple messages that I just conveyed have a similar impact in patients with very long or very short duration of diabetes. So these simple messages like healthy lifestyle, control blood pressure, control the lipid levels, and control the blood sugar, especially with new treatments that can reduce the risk of heart disease, apply to all patients with diabetes, either if it is short duration of diabetes and also long duration of diabetes.
I have to say, when I'm talking to my patients, I almost take it 1 stage further, because the longer you've had type 2 diabetes on the whole, the higher the cardiovascular risk. And because you get a similar percentage relative reduction in your risk from the same steps as somebody who has a shorter duration, the absolute benefit is actually, if anything, even greater. So the higher the risk, the more you have to gain. That's the way I talk to my patients. Would you agree?
No doubt about that. No doubt about that. Yeah. That means that the measures are important for all the patients, but the higher the risk of the patient, the more benefit and the more important is to keep these messages and these simple measures to our patients.
Yeah, absolutely. And of course, even if people have already had one event, then actually, if anything, it's more important again.
No doubt.
Thomas, I'm going to come to you because we have really got our audience interested in cardiovascular disease, but specifically here, what heart disease warning signs should people look out for if they have type 2 diabetes? Oh, you're on mute, Thomas.
This might be a little bit a problem specifically for persons with diabetes, and specifically if the diabetes is a little longer lasting, because diabetes, as I have told you already, also causes nerve damage. And this nerve damage, specifically to heart disease, to coronary heart disease, might cause symptomless patients, meaning patients who have already heart disease, and if they didn't have diabetes, they would suffer from angina pectoris, they would suffer from chest pain on exercise, which they don't do because they have diabetes. So symptoms in diabetic patients is a little bit a problem, and in my opinion, the most prominent symptom is loss of physical competence. So if you get shortness of breath at lower exercise intensity or at lower workload than you're used to have before, so this is a sign of absolutely seeing a diabetologist or a cardiologist.
Thank you very much indeed. Okay, well, we are running a little bit over. We still have a couple more questions from this session that we will answer in our main panel discussion after our break, and of course after our presentation from Jean-Luc Assele. But in the meantime, I would like to give you 15 minutes. Now we are 2 minutes over, so I will give you an extra 2 minutes, and instead of reconvening at 20 past, we will start at 22 minutes past, but just time to, as we say in England, make a nice cup of tea.